Now it is my pleasure to introduce Eric Wixom, co-founder and CEO of Wix Corp. Eric is co-founder and CEO of Wix Corp, a patient experience company. Eric co-founded Wix Corp with his two brothers with the goal of bringing sensible, innovative, and compelling service offerings to the healthcare industry with a sense of integrity, style, and fun. I like that. Prior to co-founding Wix Corp, Eric had a diverse career in healthcare, working with medical groups, specialty practices, and hospitals of all sizes. He has extensive experience with designing patient experiences, healthcare strategy, IT systems, and change management. Eric holds an executive MBA in systems thinking from Villanova University School of Business, and he also holds a BA in health science studies with a business minor from Boise State University. Now, I'd like to welcome to the stage Eric.
Thank you very much. Pass this one off. Good afternoon. Thank you very much. I have the enviable opportunity standing between you and the DJ and dancing, so we'll see what we can do. I am not dancing and singing, so it shouldn't be too bad here. I'm going to wander a little bit, if that's right. I hate being tethered at a podium here, but I'm going to talk to you a little bit about patient experience, patient engagement. There's lots of terms out there in the industry about it right now, consumerism, all sorts of fun stuff. We're going to dig through a little bit about just what is consumer or patient engagement, some of the market forces that are driving the conversation today, and how that's really kind of disrupting our industry in a lot of different ways. And we'll run through how then, with all this disruption, do we continue to attract and retain the patients that we need to be able to continue to offer the services and stay viable within our communities. And finally, we'll talk a little bit about how do we create these custom experiences for our patients. Sound good? Oh, guys, this is going to be a long hour. All right, let's jump through a little bit. As we go through this, I want you to try, we get so stuck in our day-to-day. I want you to try and step back a little bit for the next hour and try to think about your day-to-day job in the terms from your patient's perspective. And I think you're going to find some really interesting insights to how that functions and works. So to start it off, about this time last year, I had an interesting experience. So I took my daughter into her ballet class. I had about an hour and a half to kill, and I needed an oil change. So I picked up my phone, and I typed up oil change in my area, right? And it brought up, here's all the different lube shops in the area I could go get my oil change done. And it had, here are scheduling options. You can schedule an appointment, you can just drive up, doesn't really matter, you can come right in. Once I got there, the attendant walked up to my car and they said, essentially, good, better, best. What price do you want? We can do the different oil change, good, better, best. So I let him know, and I said, by the way, I have some rock chips. Do you do that as well? And he said, well, what insurance do you have? I gave him my insurance. He said, not a problem. They'll take care of it for you. We'll just do it while it's in here. So I went and sat in their lobby. I ate their popcorn. I drank the soda machine, right? And then he came in a little bit later, and he said, hey, by the way, we found the air filter needs replaced. They always tear that thing apart, taking it out to you, right? And this thing needs replaced now, and how much is it going to cost? And so they replaced that. And then they give me all sorts of payment options afterward, right? So they come up and they say, you can join our club and get a discount. We have financing. You can pay with cash card, whatever. So we go through our payment options. And they said, and don't forget, you have some maintenance things coming up. Your tires are here, transmission's here, all the different things, right? Whole thing took about 45 minutes. It was awesome. Got it all done, took my car and left. Later that weekend, I had a sick son. And I thought, you know what, I'm going to be the good husband here. I'm going to let my wife just hang out at home. I'm going to take my kid in, and I'll take care of this. And so I pull up the pediatrician's office, and I give him a call, and it was about 7 a.m. And I call and say, I've got my son. I want to bring him in. They said, that's great. You can have him in about 7 p.m. tonight. So I got to spend 12 hours hanging out with a sick kid. And then I went to take him in. And as I was going in, I just put in my phone, here's my options, right? And I put in the address, and I start driving in. The address was wrong. They hadn't updated the website information on it, so I'm driving to the wrong place. So I have to call my wife, get directions to the right place, and when I get there, the only payment information they had for me was if you're more than 15 minutes late, I have to pay $35. So I get in, and the one thing they did do similar, right? They asked for my insurance, so I gave them the insurance card. We go back, we see the doctor, and my son needed to have a couple of extra tests run. They didn't talk to me about pricing of any of that. They just said, hey, we're going to run these tests. And then as we finish, I just leave. There's no talk about payment of any kind. I just get up and leave. Now, my son was 2.5 at the time. I knew in a couple of months, he's going to need all the 3-year-old shots, all the visits, all the stuff, right? They never talked to me about any of that upcoming maintenance I need to do with him. They just sent me home, right? Having these 2 experiences in the same week was really eye-opening to me because my car got better service than my kid, and I love my kid way more than my car, right? But if the oil change shop down the road can provide a better experience for me as a consumer than I could with my child, guys, we got a lot of work to do, right? That was a really eye-opening experience for me that we need to figure this out a little bit. Now, coming from the industry, I can think of all the reasons why it's really hard to do what we just talked about at the oil change experience, right? But as a consumer, I don't care, right? If they can figure it out, why can't we? That's what we're dealing against as an industry, right? We have to compare ourselves against all of the other retail experiences that our patients are having today, and we have to be able to try and do comparable. And so regardless of all the reasons in your head why you're thinking through why we can't, consumer doesn't care, right? They want us to figure this out. So everybody should have a piece of paper in front of you. On one side's a little quiz. On the back, there's some notes on here. I want you to be able to take home some actual action items that you can do when you get back to the office. So here's your first 3. I want you to think about, as I just walked through that experience with my pediatrician, think about what are 3 patient experience projects you want to tackle this year. It could be big projects. I want to move from a decentralized scheduling process to a centralized process. I want to deploy a new software platform. I want to, whatever it might be, right? What are 3 big projects that you want to have on your wish list that you want to take and try to work on this year? Now, I see a few pins moving. What are some of the things you're putting down? Here's where we knowledge share as part of HFMA, right? We best practices. Who wants to be brave and raise a hand? What are some of the things we're putting down? Yes?
Accurate registration process that doesn't, accurate registration that does not, that prevents the need for rebilling.
Yes, please. That's like the holy grail of patient access, right? If we can figure that out, life is going to be so much easier. I love that one. Any others? Yes, please.
Concierge service for employee health.
Oh, I love that.
We need to make our employees our best ambassadors. Right now, they're not.
I love that one. So that's the first I've heard of a better employee health experience. I love that. Thank you. Yeah.
Change the delivery model.
Oh, yes. The whole bloody model's got to go. I had a slide, so I'm a nerd if you haven't figured that out yet. And I have I usually put in a slide of the whole healthcare system, industry, and why it's all broken mess. And I agree, we just need to push it and try again. Love it. Okay, so let's talk about some of the market forces of how we ended up here. So first, we're a third-party payer system, right? That's insulated us a lot over the last, 50 years. So that a lot of these consumer market forces haven't been impacting us that much. So all the other industries that had to figure this out, you think about retail and finance and all these other groups, they figured this stuff out back in the 80s and 90s. We haven't had to because our inflow just came from insurers. It didn't really matter, right? But that's shifting dramatically. So these are high deductible health plans, if you can't tell. That chart is just continuing to grow year over year. I don't see that changing, because employers and insurers have all hit that saturation point of they're not going to continue to pay the rising cost of healthcare. So that means the continuing rising cost is going to go on the patient. And that's where it's been going, it's going to continue to go. Look, if you think about premiums for the average household of 4, premiums went from $5,000 a month in the last 20 years to $23,000 a month. That's a huge, have wages gone up that much? No, right? This is a burden on our patients and our consumers. So they're now having to vote with their dollars who they're going to go see, because it's expensive, right? When we add all that up, so in the last 24 years, right, 745 billion in bad debt has been written off. And we're just going to continue struggling with this, right? 41% of US adults have medical debt. That's my newest metric that I just pulled from the Kaiser Family Foundation from earlier this year, right? Think about it, almost half of US consumers have medical debt. That's a heavy burden to try and cover, right? From an economics perspective, I know you can't read this, don't get mad at my slides, I'll walk you through it here. So this slide is showing the relative cost of goods. The very bottom line is a television. So if you think about a television, 20 years ago, if you wanted to buy a flat screen TV, you were gonna spend $5,000 minimum, right? They were really expensive. You can now get it at Walmart for about 200 bucks. That's awesome, right? It has gone down relative in cost to everything else, which is fantastic. The very, very top line there is medical costs, hospital specific, right? Even the pandemic didn't budge that number. Those costs just continue to go up and up and up, and everything that we've tried to do, whether it be through government intervention, whether it's been changing models, right? Nothing so far has actually bent the curve yet, because from a technical term, right, we're a self-replicatingly broken system. Everything we try to do just ends up making it worse so far. And from a consumer perspective, when we think about the broader economy, there's a lot of issues, right? There's a lot of employer-employee issues, so we're seeing a lot more strikes. We're seeing lots of layoffs. The tech industry and the fintech specifically, massive, massive reorganizations, right? That's the nice way of saying layoffs, right? We've had a ton of shifts there. So that means for our patients, their employment is not stable. They don't feel comfortable with, this is where I'm gonna be long-term. Political systems are a little crazy right now. We don't need to go into a lot of it, right? But as consumers, we have lots of concerns, a lot of hot topic items. What this means, if we think about all the different economic forces that are coming down, we're jittery, right? We as consumers, we're jittery, we're anxious, which means we're much more cognizant of where we're spending our money and where we're investing because we don't feel stable with where we're at today. And I can tell you healthcare bills are probably the bottom of that pile of stuff they're working through that they're gonna try and manage, which means for us, we have to try and figure out how do we be helpful and still help them manage the financial aspect of that care. The net result of all of that, right? Half of rural hospitals in the US today operate in the red year over year. That's a scary number, right? Because this is the heartland of America, right? This is where the bulk of our patients are living and experiencing. If that hospital goes down, they're usually the top 1 to 2 employers in that community. Usually it's between them and the school district as to which is the #1 employer in the community. If the hospital starts to struggle, you're gonna have a lot of issues in that community. And often they're very geographically dispersed. So if that goes down, are you driving a half an hour? Are you driving 3 hours? How far is it to that next care center, right? So even if we're an urban center and we're feeling comfortable, if our rural access centers start to go down, how are we going, how as an urban center, how are you going to reach out and engage with those communities and those patients without that local delivery mechanism? Who here has some of those partnerships? Do we have, so I haven't spent tons of time in Washington. Do some of our urban centers, do you have outreach programs with your rural partners? Have you formalized those arrangements? Opportunity, right? Think about for your hospital association is a great mechanism to try and engage with that. Getting partnerships there to help and assist is pretty phenomenal. I'm from Salt Lake, and in Utah, they actually have a really, really good program where within the hospital association, they have a whole rural health council that meets regularly with the local hospital, larger hospital systems in the urban centers, and they share resources. They do lots of, we will do a telehealth appointment with our orthopedic surgeon in advance, and then once a month we'll have our surgeon come down to the hospital, right? Lots of affiliations, lots of opportunities there to collaborate. Part of that's due to staffing, right? So staffing, absolutely a huge concern for everyone right now. The scary part about staffing, I'm going to skip ahead here, your patients are worried about staffing, right? This study scared me. Was this Kaiser Family? Yeah, this was a Kaiser Family Foundation study. They found that 52% of patients were worried about receiving their care because of your staffing issues. Let that sink in for a second, right? If we're having so many struggles with staffing that our patients are worried about coming in, probably need to rethink a few things. However, I think things are starting to get better. Who here within the next 12 to 18 months will be zero travel nurse support? Is anybody still using travel nurse support? It is, all right, so back to pre-pandemic level. Let's put that, back to pre-pandemic levels for travel nursing. Everybody feeling good there? Awesome. That's fantastic, right? We're getting better there a little bit. The other issue is just consumerism in general. So if we think about opportunities to receive care, it's gone up about 42%. It's really hard to see on this graph. I apologize. The big bar on the bottom is primary care. Primary care has grown dramatically, which is great. It means we get more doctors out there for preventative medicine. We've added things, though, in the last 20 years, like telehealth, retail clinics. Our outpatient surgery centers have grown pretty dramatically, right? We're starting to do more and more of getting more delivery channels available to our patients. But what that also means is we need to think about how are we staying relevant in that new marketplace? How are we going to make sure the patient that we've had a long-term relationship with is now going to drive past the 3 new options that they have to get to ours? Or how are we going to make sure that they're going to come physically to our facility versus working with a telehealth group? I was just in Montana a little while ago, and they had just credentialed, one of the insurance groups there had just credentialed a group out of California, 100% online, 0 brick and mortar, and they can now provide primary care for the entire state of Wyoming for any of that insurer's population. For all of those rural communities, that's fantastic for those patients, right? I can now just jump on the phone and I can access care versus having to drive 30 minutes into the facility. But now for that facility that they've been with for decades and generations, how are they competing? And how are they going to maintain that, right? And there's some things we can dig into, but essentially the competitive landscape is changing pretty dramatically around us. We need to figure out how do we stay relevant within that changing marketplace. The other component of that is our patients, again, about doubled the cost of out-of-pocket expense. Because they're feeling that cost directly now, they're going to be way more cost conscious about where they're spending those funds. Fair? All right. Net result of that, 100 million US citizens do not have primary care provider today. I have not seen a primary care physician in a really long time. I'm a pretty healthy guy, so I don't worry about it. And if I get sick, I go to the urgent care. And that takes care of it for me, right? Now my kids go to the pediatrician often, and they do all the normal things there, which is great. But as an adult, I know I should. I'm hitting that age that I really should too, but I don't want to admit that yet, so we'll just keep going, right? If we don't have primary care physicians, though, if 1 in 3 Americans essentially don't have primary care physician, what are we doing around maintenance? What are we doing around outreach? Are we boosting up our urgent cares? Within our urgent cares, are we talking to them about maintenance? Are we talking to them about, hey, Eric, you're hitting that age, you should start scheduling things, right? Are we adapting to the way that our consumers are starting to access care? If I were to pull all this together, right, this has all the telltale markings of a disruptive industry. So to my colleague's comment earlier, right, we know the model's broken, but our consumers, our patients, know the model's broken as well. And that's not a sustainable thing. If everybody involved knows the system's not working, something's got to give, right? Thankfully, we're not the first industry. Like I said, because we're in this third-party payer system, we've deferred this for a really long time. but that means we can look at all the other industries that went before us. Think about what Uber did to the way that we travel. I haven't gotten in a taxi for a really long time, right? I just grab an Uber and I go. Thank heavens for Netflix during a pandemic. I have 6 kids, y'all. Netflix saved my life during the pandemic. I'm grateful that they had already gone through all of that. What's interesting is when we look at all of these different industries that have had to go through these really dramatic changes, they all have one common thread. They all had the exact same thing that facilitated the change and the disruption. If you take any notes from today, this is the one. They leverage technology to change the model, right? We have to change the model. And in every situation, they leverage technology to be able to change that model and make it work. So let's look at it. Let's take an example. Who here remembers Borders? Right? Okay. I loved Borders. It was the best, right? You had, on average, about 100,000 different items in a Borders shop. They had every book, every CD, every disc. It was fantastic. There was the coffee shop in the middle. You could live there. It was great. At their peak, Borders was one of the top 10 retailers in the world. They had well over 1,000 locations. They were doing phenomenal, right? And then a little thing called Amazon came along. In 8 years, Borders filed bankruptcy and disappeared. That was it, 8 years. And one of the top 10 retailers in the world was completely gone. When we think about what Amazon has done since then, right? They didn't just change the way that we purchase books. They have now become a movie studio. They've become audiobooks. They create devices with our at-home Echoes and everything else, right? They have changed the way that shipping and logistics work. They have changed the entire platform in so many different industries, by far way more complicated than any other company in the world right now. As a consumer, how easy is it to work with Amazon? Very simple, right? We as a customer, we can use their voice devices, we can download their app, or we can go to their website. We can bounce between any of those 3 channels. We can accomplish everything that we need to do. Now, who here has actually spoken to an Amazon representative? 1, 2, 3, right? We got 4, maybe 5 people in this room that ever spoke to an Amazon representative. Do you realize you're Amazon's #1 employee? All of you who didn't raise your hand, right? You're doing all of the normal work that an employee would be thinking of doing. You're doing the searching, you're ordering what you want, you're facilitating the checkout. If there's a problem, you're doing the return. You are Amazon's #1 employee. And you love it. And they're not paying you a dime for it, right? Think about how upside down that model is. Now think about what would happen if you could do that in healthcare. Now obviously the patient can't be their own doctor, they can't do their own surgery, right? We don't want to take, but think about if we as a consumer prefer to do the work on our own. If we prefer to not talk to a human being, we prefer to open up our phone and manage our own things, how much of that, completely change registration so that there aren't any downstream denials and all the issues, right? What if we could put the patient in charge of doing that on their own? Right? Do you think they know their address and would get it right? Hopefully, right? The model needs shifted a little bit here. When we think about Amazon's model, the technical term, they're a self-serviced omni-channel experience. Now, I'm sure you've all heard the buzzwords around omni-channel and all that stuff, right? I want to break it down just a little bit to make sure we're on the same page. Think about from a banking industry perspective. Used to be single channel. If I wanted to do anything, I had to physically go to the bank, and I would do all my banking needs at the bank, right? Then a little bit later, they became a multi-channel, where I could go to the ATM and I could withdraw money, or I could write a check and send it out, and then it would cycle through, right? But in that multi-channel era, if I put money in the bank, how was it available immediately at the ATM? No, there was lag in the system, right? All right, now here's where you all have to be honest. Who here wrote the rent check with 0 funds in your checking account? Oh, come on. I can't be the only one, right? We knew there was lag in the system, and we knew, you know what, I haven't got my paycheck in yet, but I know I can give my landlord the check because by the time it gets through, the money will be there. we as consumers knew that there was lag in the system and we banked on it and we would use it all the time, right? That's that multi-channel where even though we have multiple ways of interacting and engaging, they're very siloed and very segregated and they're not integrated. Omni-channel means if I go to use my debit card and because I'm traveling and I'm in Seattle, they're going to decline it and I'm going to get a pop-up on my phone that says, are you traveling? Is this okay? I can hit yes. I can use my card again. It will go through, right? Or it could be declined because the funds aren't there and I could go onto their website, I could transfer funds, and then I could use it right away. All the different channels are in sync real time, right? That's omni-channel. That's what we as consumers expect. We expect that if you send me a paper bill, that number one, it doesn't say this is not a bill, that it will actually be the bill, and I should be able to pull that bill up online and view it, and I should be able to call any of your people, and everybody has the same dollar amount on the 3 spots, right? And I can make a payment over the phone, and I can refresh on my screen, and it shows the payment, right? These are the things that we as a consumer expect that within the industry, we're still really struggling with being able to figure out how to get there. So let's give an example here. I love this quote. So we have Henry Ford came out with the Model T, right? And he told everybody, you can have it, you can love it. It comes in any color as long as it's black. And then a little while later, you had GM, and GM said, you can do whatever you want. You can change the fins. Those are pretty awesome fins on there, by the way. Right? You can change the tires. You can change the upholstery. You can change anything you want on the car. You can customize it any way you want, right? On the Ford side, it was really simple for Ford, right? We had the assembly line, and we could pump those things out, and quality was great, and we could get them through really, really quickly. But there was zero option for the customer, right? On the GM side, the customer can do whatever they want, but there were over 1 million potential car variations that they could produce from that factory. That's really hard to be able to produce and have high quality, high standards, and be able to do it in a cost-effective manner, right? On the Ford side, it's a very customer-driven industry, right? He said, this is what you get, and you're going to love it. Excuse me, a very company-driven. Thank you. On the GM side, very customer-driven. You can do whatever you'd like, right? Now, where's healthcare? Ford's, okay. It's a little bit of a trick question. I don't think it's either. I think we're EMR-driven. I think we get whatever EMR we're going to get, and then we have to adapt to make that work. So here's a simplified kind of process of an EMR, right? I'm going to get that EMR software, and then they're going to say, here's how it functions, and then I'm going to try and adapt my processes to make it work. And the patient then has to try and figure out how on earth they're going to integrate with it, right? And so it could be on paper, it could be a phone call, who knows, right? We get our EMR in, we build our business processes, and then we pray the patient can find their way through it. If we wanted to inverse this and make this exact same slide from a patient perspective, it looks something more like this, right? Way simpler. I can get an estimate, I still have to do the same stuff, right? This is the challenge I'm hoping you take home from today is take from a patient's perspective and go back and look at how do you do business today? Who are the people that are doing what jobs? What technology am I leveraging? What are those processes? And how do my team and my patients like it? And what are the gaps in there? And how do I start moving towards a more seamless experience for the patient? Because if I can get to something more like this, where a patient can self-service their way through in a logical, easy-to-understand fashion, they're going to have a much better experience, right? Oh, yes?
Devil's advocate here. So I've been in industry for many, many decades. I love that model. I think, can people hear me? No. Okay. So, well. Oh, I don't think, yeah, okay. So, someone who's been in the industry for many, many decades, when I see that model, I like it. But then kind of the elephant in the room is if I have 10 patients that come in, though, on the provider side, that model may look 10 different ways because of 10 different insurance companies that have 10 different requirements and all the permutations. And so, without making excuses, when we think about, some of the other industries, the fragmentation again just puts this complexity in, when I think it's interesting whether it's Haven, whatever, all these outside industries come in, oh, we can do healthcare, and then they fail because of the regulation and the variability. So I think as an industry, until we reduce the variability, I won't sit here and say single payer, but to have more commonality, then we can simplify that. So what are your thoughts?
A lot. So you bring up a couple of really interesting points there that we need to talk through. So from a patient's perspective, I don't care. You got to figure it out, right? From an internal perspective, we know the model's struggling, right? We know long-term we've got to change the model. We have to figure out a way to bridge the gap between the two. How do we operate in the complexity while hopefully driving towards a better system? My recommendation is generally try to build systems and processes that will work for the 80%. The bulk of your patients, you can get through pretty similar processes and then have really good exit ramps for the 20. If you try to build for the 100%, you're going to break it for everybody, right? Grab the ones, and it's the right pace. We'll dig into it a bit more, but yes, there's a lot there that we need to try to get from current complexity to future. It's interesting as well, you bring up Haven Health, right? So Berkshire Hathaway, JP Morgan Chase, Amazon all came together. They said, we're going to fix healthcare. This is going to be awesome. They all dumped tons of money into it. They made it almost 3 years before they went belly up, right? Last fall, Warren Buffett was asked about it during his stockholders meeting. And they said, what happened to Haven? It was supposed to fix everything, right? Does anybody know his response? Oh, we need more nerds in the room. You guys got to listen to this stuff. Okay. His response was, healthcare is the tapeworm on the US economy, and the tapeworm won. Right? We are dragging down the economy and not adding anything to it, and the tapeworm won. We just aren't incentivized enough within the system to break the model and build a new one. And he cashed out. It wasn't worth the fight, right? So it's going to be up to us in this room of how we want to try and change that model. Sorry, I had my back to you. I didn't mean to, sorry. I wandered too much. Okay, so we talked a little bit about data and how we're EMR driven. In the last presentation, talked a lot about data, right? So within healthcare, we're producing 25 petabytes of data every single year. And that equates, 50 petabytes, which equates to 25 trillion typed pages every year of data that we're creating. Now to put that into scale, because I don't know, we're getting to crazy numbers here, right? To put that into scale, 1 million pages, if I took 1 million pieces of paper and stacked them up, you're going to get about half the height of the Space Needle, right? You're going to get about 300 feet of paper at 1 million pages. The difference between 1 million and 1 billion puts you about halfway between Earth and the International Space Station. The difference between 1 billion and 1 trillion pages is going to put you about halfway between Mercury and the Sun, okay? So if we're going to do 25 trillion pages, that happens to be the exact distance between Earth and Uranus. Now, my wife had tons of jokes I'm supposed to tell right here. Not going to tell them. We're producing a ridiculous amount of data in healthcare. The scary thing is, 97% of it never gets touched. We're collecting tons and tons of information. We have all this stuff going on. We have all this information in our EMRs, and the problem isn't the data. The problem is getting clean data that we can interpret and access all of it, right? We have a ridiculous amount out there. What do we do with it? How do we manage it, right? These are some of the things that we need to try and harness and figure out so that we can start to change that model a little bit and start creating that better process for our patients. There's going to be a lot of change coming into healthcare. Everybody sees this disruption coming. This chart's showing the investment into healthcare startups of companies over $2 million. There's been $75 billion of investment into new healthcare startups in the last 5 years. Some of these are going to fail. Some already have failed. But there's going to be some winners in there. The takeaway from this means you need to get comfortable with change. There's going to be a lot of change that happens in our industry over the coming years. We need to figure out how to harness and manage that change and get comfortable with changing, because it's going to be changing a lot. And so we've got to figure out how do we manage those iterations, and how do we get our teams comfortable with those changes so that as those winners come in and we start to have those opportunities, how are we harnessing them as quickly and efficiently as we can? So if we think about in the news, some of those changes coming through, who here knew that you can get full family practice coverage for $9 a month from Amazon? That started a couple hands, right? That started late last year as part of, if you're an Amazon Prime member for $9 a month, you can have unlimited primary care, right? One of my favorites, the second one on here, Best Buy working with Mass General. If you send home patients with medical devices, Best Buy is their help desk. They will go out, they will make sure that the Bluetooth is synced up, they'll make sure that those devices can connect to the internet. If the patient's having problems, they're calling Geek Squad manages it, right? You're gonna see some really cool programs from retail coming into healthcare where we're gonna find those synergies. During the pandemic, you could get a COVID vaccine from your UPS driver. Did you know that? Right? I don't know that you want to. I don't know that I equated UPS driver with vaccine, but they had it available, right? You're going to start to see retail pushing into it a whole lot more to try and help figure this out. To the comment that was made earlier, right? Like we've got retail's coming in, they're taking some of the fluff on top, some of the cream on top, but that also means some of your number one competitors to be able to attract and retain talent are now Amazon and CVS and Optum and Walmart. So there aren't any clinics at Walmart out here yet, but has anybody gone to a clinic at Walmart before? They're mostly down in like Florida and Georgia. Texas, no? They're really cool. You go in and it's literally a menu on the wall. And I'll take a number 5, right? I need my CDL physical, or I need whatever this is. And you can go in and you can just run. And they didn't even take insurance for a long time. I think they're starting to do a couple of insurances today. But for the most part, it's just a cash business. You go in and you can be seen for whatever you'd like. They're growing rapidly. They doubled in size last year. I think they're like 30 or 40 sites now and continuing to grow, right? It's going to be interesting to see what they pull off. Now, I can't talk about the change going on in the industry right now without bringing out AI a little bit. Who here has played with ChatGPT or something comparable? A few hands, okay? It is a ton of fun. You're going to see a lot of changes with AI coming into the industry. It's not going to replace your doctor tomorrow, right? One of my team attended a big consumer conference last week, and they were talking about applications of AI. Some of the most powerful ones they're finding right now have to do with customer service support. Think about how powerful it would be if your PFS team, when they pull up a patient account, that AI scrubbed every single medical record and pulled up front to the top a 10-sentence paragraph summary. This patient is seen on a monthly basis, usually for this. They have an outstanding bill for this. They never pay these pieces. They always do these things, right? If it could scan the whole record in seconds and return back, here's a summary and here's what you should do. That's really powerful, right? You're going to start to see applications of AI like that into healthcare. Again, start to get used to change. There's going to be a lot of interesting things coming. I usually equate this to when AutoCAD came out for architects, right? Everybody's like, oh, this is awesome. We won't need architects anymore. The computer will just do all of it. Obviously, that didn't happen, right? But what it did do is it made architects way, way more efficient with their time. It increased compliance. It increased the standard of the work they were doing. It decreased the issues with it. It really empowered them. I think you're going to see the same things within healthcare coming where you're not going to replace your clinical care team, but you're going to empower them. And you're going to reduce risk, and you're going to increase output, right? So I used AI a little bit, and I gave it a prompt. And I said, I want to see an image that depicts the complexities of the patient experience for a hospital system. And it generated 3 images for me. You get to vote between the ones you like. Here's the first. So very revenue cycle. I think it took the cycle as a keyword there, and it has all sorts of stuff going on. Here's the second image. I really like the broken heart in the middle there. And then here's the third. Okay, who votes for number 1? No hands. Number 2? Couple of hands. Number 3? There it is. Every single conference so far that I've been showing this the last 6 months, it's been number 3, right? It seems to capture that anxiety, right? That anxious buildup of all the craziness that's going on, right? I think this is a really good depiction of what patients and we as employees tend to feel like about that patient financial experience. We've got to find ways to simplify that a bit, right? So here's your next couple of things to write down. We've talked about a ton of stuff over the last 40 minutes. It's been 40 minutes already, holy cow. When we think about some of the quick fixes that you might want to make, what are 3 quick fixes that you want to make next quarter dealing with patient experience? This could be going to your registration desk and pulling out any piece of paper that was a photocopy of a photocopy. The original was made before 2000, right? Get rid of it. Get a current one out there, right? It could be going in and doing, just start at your front door and walk through as if you were a patient and start jotting down the broken chair, the little, there's a ton of just quick fixes that you could look at. If you still have a fax machine anywhere in your building, please add that on your list as a quick fix to get rid of it. At least move to an e-fax. If not, get rid of it completely, right? Just anecdotally, so the pager was the number 4 used device in response to the pandemic. The one we just had, pandemic, right? The pager. It's crazy to me how some things just stick around, right? Think about what are some of those quick fixes you can get in and play with. Okay, so now let's talk about if all this stuff is changing, how do we stay competitive in that marketplace? How do we attract and retain the patients that we're looking for? I love this quote from Brendan Witcher. He's an analyst at Forrester. Every time a patient has a new, good digital experience, that's the expectation for everything going forward. Right? So think about, this is why if you go on to Netflix and something, they have a cool new feature, and then you'll see it on Amazon Prime a little bit later, you'll see it on Disney Plus and HBO, right? As soon as we have a cool, good experience one place, that's our expectation going forward. Again, this means that your number 1 competition is not the other healthcare delivery provider next door. It is Best Buy and Amazon and Walmart, right? Places that are having really, really good retail experiences. That's the moving target that your patients are expecting you to be able to compete with. So if that's the case, we're moving from a cost and product quality competitive marketplace to an experience competitive marketplace. So let's talk through that a little bit, right? So we have price and quality. It used to be if I want a high quality, high price good, I could go and buy that, or I could buy a low cost, low quality good. What happens over time, market forces start to push those 2 things together, right? The high quality is going to reduce its price, and the low price is going to increase its quality. And over time, you start to hit a parity, where you can go to, at the time, right, you could go to Radio Shack, and you could get the really cool DVD player, or you could go to Best Buy and get a medium, or you could go to Walmart and get the crappy one, right? Over time, they all leveled out. You could get about the same one at any of those locations, right? So then the difference becomes what experience you're going to have between the 2. I can go to Best Buy, I can talk to their representative, I can learn all about the different types of things, I can see them up on the wall, I can touch it, I can feel it, I can get education around it, I can purchase it, they will load it up in my car, and I can take it home. Or I could go onto Amazon, I could buy the exact same television at the exact same price, and it will show up at my house in a day or 2. Neither is a bad experience. Both are a really good experience. The difference is I, as a customer, am going to choose the one that I want. So that means for you, you need to decide what type of an experience do you want to provide for your patients. Are you looking to be a low-cost, broad, I'm going to do quick services, lots of urgent cares and lots of in and outs, right? And I'm just going to try and cast a really broad net? Or am I going to do a more targeted where, you know what, I'm going to get known for women's services. We've got a lot of young families that live in my geographic area. We're going to focus on that demographic, and we're going to build a new women's center. We're going to do a lot of outreach. We're going to build all these programs around it. Neither of them is a bad situation. You just need to decide, who do you want to be? Who are the patients you're wanting to attract, and what is the experience that they're looking for? And then you need to start building those experiences for them, right? The way that you would kind of build this out, very, very first, you have to have executive buy-in, right? You have to have somebody at the executive team that is accountable for patient experience. It can't just be a patient experience team out there that's trying to do stuff, right? At the top levels, you have to have somebody on that executive team that's in every meeting that is accountable for the patient experience. You then need to have a really good patient advisory council where you have actual patients that you talk to, right? If you want to know what's wrong with your health system, go ask one of your patients. They will tell you for days what you could fix. The key is grabbing the right patients. If you have lots of young families and you want to build that women's center, get young moms, get young dads, get families on that advisory council to help you understand what can we do to make a better experience for you. If you're in an older aging population, then bring in those folks, right? But decide who are the patients that I want to have and what can I do to attract and retain those patients better. And then build those internal teams that you work with from all your different departments that have representation within that patient experience team that can say, if this is where we're going, if we're going to focus on the new women's center and the new OB pieces, what's my role in that? What does my department need to do? What do I need to change within registration to have it be a better experience to get them through? Then you need to go through and walk through all of that from the patient perspective. You're going to sit in your ivory tower, you're going to come up with all sorts of great ideas, you're going to put it out there, and it's not going to work the way you thought it would on your first try. You build those feedback mechanisms and look at it iteratively so you can make sure that you're keeping up with what they're looking for and that your intent is coming across. Feeling good so far? All right. So we're going to write down a couple more things. So as we think about part of that experience, right? I missed this piece on the last slide, sorry. You're going to have lots of third parties that you work with, right? You're going to have, if you're working with an elderly group, maybe you have lots of transitions into home care and into hospice. You're not providing every single solution, but in the patient's mind, when I'm transitioning to that hospice team, that's still part of the healthcare experience I had with you as the health system, and that's going to impact you, right? The ambulance groups that are coming in, the outsourced ER provider group, you have tons and tons of third-party vendors and third-party organizations you're dealing with. The transition between you and that third party is where the conflict or the magic happen. Look at those interactions and decide what you can do to make it a better transition to provide a better experience for your patient. So write down who are two of those organizations that you want to talk to within the next month to discuss how could we work better together? How could we make a better transition for our patients in their care journey? All right, so in the last 10 minutes here, we're going to walk through, we know that, to the point earlier, right, we know the system's broken. We know that we can't change it all today, but what can we do? What are some of the things that are viable today that we can do to create a better patient experience? So we're going to walk through a few of those. The first thing you need to think about is we often ask the wrong questions when we talk about patient experience. So if I ask, if a patient wants to pay their bill online, right, then I need to make an online terminal. I'll create a virtual terminal where a patient can go pay a bill. And you can put that up there and nobody will use it. And it'll just sit there empty because it doesn't make sense with any of your business processes and it's not what your patient's looking for. You're asking the wrong question, right? What you should be asking is, how do I engage with my patients better in a mobile environment, because we know we're all on our phones, to then be able to help facilitate paying that bill. The solution then becomes something that is simple to access, intuitive to use, and engaging to interact with. That's going to put you in a way different place than I need to put up a virtual terminal, right? So think about the questions you're asking and try to look at it from your patient perspective. So I'm going to try and help you understand patient perspective a little bit here. I'm going to give you a few takeaways. The first, your patients are, vast majority of them, digital communication channels, right? 79% prefer a digital communication channel than to talk face-to-face with you. In my experience, That number is way low. Who here would rather do it on their own than just talk to a person on the phone, right? Like we would way rather just do it on our own than have to call and talk to somebody. Text messaging is by far and away the preferred mechanism to be able to talk to patients. Even if they don't respond, 98% at least read what you sent them. That is a powerful metric, right? Think about right now, we're sending out paper notifications. Who here even opens their mailbox anymore to be able to get that stuff out, let alone open the letter and actually read what's on it? Right? We're just not there. We don't have the time. We don't have the patience for it. Our consumers are the same way. But a short text, they absolutely will read it. Okay, a couple more takeaways. Not all digital tools are the same. There's lots of stuff out there that say digital is the way, so we'll do like a digital IVR or something like that, right? Digital voice is not where they're at. They don't want to talk to anybody on the phone. They're not. And apps are not the solution either, right? We download the app, do whatever it is that we need to do right in front of us right now, and then we delete the app and we move on. That's just how we function as consumers. I don't want that app taking up space on my phone, right? I'm going to do what I have to do, and then I'm going to get rid of it and ignore it. Apps are not where your patients are at anymore. The expectation is you need to be able to have a website that is mobile enabled, right? That's built mobile first so that they can open up their browser, they can scan a QR code, they can click on a link, whatever it might be, and it opens up a web page that is built for their phone so it looks and feels like an app, but it's just from the website. And then you don't have to have it downloaded. Now there's limitations on what you can do from a website versus an app, but those differences are so nuanced that your consumer really doesn't care that much anymore. Okay, the next one, patients want to do the work for you. Make them your number one employee. 80% prefer digital payment options. The scary metric, 70% will leave you have a better online payment experience. Regardless of how long they've been with you, regardless of if their dad and their granddad were all seen at your facility, if it's not an easy payment experience, 70% will leave. Okay. Payment plans are awesome. We as consumers love payment plans. 81% more likely to pay if I'm on a plan, and the cost for us is 60% less, right? The underlying reason why we like payment plans is because we as consumers love options. If you tell me you owe $100, pay now, I'm way less likely to pay. You say you owe $100, pay right now and get a 5% discount, pay over the next 2 months in these installments, whatever it might be, right? If I have options, I'm way more likely to choose at least one of them to set up that payment, whether it's a payment plan or a discount or whatever it might be. But again, as a consumer, I love discounts. And so leverage that. We're in tax time right now. Who here is offering a tax time discount? Is anybody? A couple of heads are nodding, right? So we've worked with facilities that have had some really great success with targeted tax time discounts. So things like if you're on a long-term payment plan, I will offer you 25% off to pay it in full today. They'll do the same thing at the end of the year in December because there's HSA funds that are expiring. And so they'll send out to those payment plans, if you pay in full before the end of the year, we'll offer you X% discount. On the early pay, the pay now, so if you pay in full right now on this new bill that's under 30 days, offering them a 10 or 15% discount really is just giving them that option of, if I pay now, I'm willing to put it on my credit card because the interest rate, like they're balancing in their head, is the discount worth putting it on my card? You need to decide for yourself and your institution what's that number, right? But the cost to collect is so high, we highly recommend offering at least something on that front end, even if it's only 10 days. Putting something on that front end to get that early pay discount. Because again, we as consumers love to have those discounts. Take advantage of that to decrease your operational costs in AR. There's also lots of buzz right now in the industry around text to pay. Text to pay could mean a lot of things. There's a broad spectrum of what that means. That could be everything from I'm texting you to let you know you need to pay, to I'm texting you with a link for you to go pay, to then on the other end of the spectrum, I'm going to text you and you can respond and it'll automatically process the payment. Patients obviously want the far end. They don't want just the notification, but anything in there is good. But within the industry right now, it's a fuzzy term, so just be mindful within text to pay, it could be a lot of different things in there. And then finally, again, patients are on their phone. Patients are mobile, right? That's where they live. If you want to engage with your patients, you have to find a way to get on their device. That's where they're going to engage with you on it. Okay, so here's your last couple of takeaways. Who can you talk to within the workplace, and whether it's an individual, a team, who do you want to talk to next week to start thinking about what are the changes I want to make within my patient financial experience? How can I improve it? What changes should we make? I beg of you, at least one of these individuals, make it a patient, okay? Talk to your patients. They will tell you what needs to change to be able to be creating these better experiences. So find those individuals who you know use your system, who are part of that group, that demographic that you're targeting, and talk to them. Ask them how their last visit went, what went well, what didn't go well. You will be amazed at what you learn from those individuals. Okay, so final recap here. When we think about patient experience, when we think about patient engagement, consumerism, all those kind of buzzwords in the industry right now, really what it means is consumers are taking over driving a lot of our industry, right? The revenue that came directly from patients used to be about 5% of your total revenue. It's now pushing a third. Because it's so much, we have to figure out how are we engaging and interacting with them. And this doesn't mean that we just build a new lobby up front. This doesn't mean that we launch this new platform. There's a lot more to it than that. I was talking with a critical access hospital a little while ago, and they went through some of these processes where they listened to their patients, they talked to their teams, and they realized, you know what, for us as a health system, patient access is the bottleneck right now that we're struggling with. That for us, we need to fix this. And so we need to be able to help empower. So the patient said, well, we want you to text us. So they got a texting platform. And then their team said, well, we'd love to have online scheduling to help funnel everything in. So they got an online scheduling system. And they said, well, we need to be able to have them do digital forms before they arrive. That would be great. So they got a digital form system. And they continued going down the line, listening to everybody of, okay, here's the things we need to do to get this all out there. At the end of the day, they launched 7 new platforms for their patient access team to be able to engage with their patients. Who here thinks that that was a success? Right? Everybody's anxiety is going up a little bit, right? Like these poor patient access teams now have 7 different websites that they're opening up or different platforms. They're trying to manage it all. There's so many communication channels coming in, they can't manage it, right? And it's created more chaos. The intent was good. They wanted to try and engage with their patients better. It's complicated. To your point earlier, there's a lot going on. There's a lot of different channels. There's a lot of different qualifying factors. It can be really hard to pull it all together. The challenge for us then is how do we try and create systems and processes that regardless of how the patient wants to interact, that we have good mechanisms to try and bring them in and create good experiences. Some of it's going to be new technology and some of these disruptive systems coming in. Some of it's going to be business process change. Technology is not a silver bullet. Even though we have a lot of amazing tech coming through, we have AI, we have all these things coming out, in and of themselves, they will not fix a single problem that you have. The magic happens when that technology is overlaid directly on top of your business processes and the two are in sync. That's when the magic happens, and that's when your teams are effective, and that's when your patients have the best experience, right? So as you go through these processes, try to find those ways of connecting everything. All right. Thank you so much for hanging with me. We made it quite a while here. Any final questions or anything? Almost a clap there, too. Thank you. Any final questions or comments? Yes, please.
Is there a microphone? Oh, perfect. So as we talked about that ideal financial journey, right, where you have an estimate and then you schedule it, and then other things happen, right? Care's delivered and you pay. I know it's complicated. My dentist does it. It's the same kind of thing, right? Two different insurances and complexity of copays and where are you at with all these other things. So, I mean, those things happen in other parts of healthcare, and I feel like the health delivery systems are resistant to try and provide that kind of a estimate. And are you seeing anybody doing it well across the organizations you're working with?
Yes and no. My sales guy would say just go talk to him and he'll tell you how we'll help you do it. But really what it comes down to, it's going to depend on your EMR because they're going to have certain functionalities that can help. It's going to depend on business processes, all sorts of things. But from a big picture, what really has to happen is you have to look at current state today. What are the systems and processes and technology I have ready? What is it that I'm trying to get to, and how can I try and pull these together to get there? We absolutely can do it. The answer is different for every one of our health systems. Some of them have EMR platforms that have enough functionality that with some tweaking and some business process changes, they can make it work. Others, it's too much, and they're bringing in third parties to try and help manage it. It's tricky for sure. The key is to look at the interaction points between those processes and systems because that's where you have the most leverage to make change. From a patient's perspective, we don't want to make them think. As soon as you have to think, you've lost them. And that's just how it goes, right? And so we want to try and make something simple and intuitive enough that it walks them through. So sometimes that means we're going to start at a patient estimator, and we're going to put an exit ramp button on there that says, you got this estimate to schedule, click here, and then have that either go to your patient financial counseling team to help them with it, or have it go to an online scheduling tool, depending on what you have available. And then looking at those and saying, okay, what are my exits from here? From PFS, are they manually putting something here? What does it look like, right? But looking at the interaction between all those touch points and making sure that the patient doesn't have to think, that they're not lost. Some of that's a UI change, right? Some of it's just how do we design our digital environment to help them through it. Some of it's business process, but it's the connections.
So the No Surprises Act and other legislative solutions have not, I don't think, moved the needle very much. Like,
No.
if you're going to have to predict what's going to move the needle, and maybe it's a question for everybody, but is it going to take people defecting to other systems of care delivery
There is
to get us all to change?
Absolutely. To the point earlier, I think a lot with model has to change. There's an orthopedic group in Oklahoma that is absolutely phenomenal. You go to your website, and they have a picture of a skeleton. And you click on the part that you want to talk about. So I'm going to click on the elbow, and it drops down a list of here's the different surgeries and solutions that we offer on an elbow, and here's the cost. And I can select any one of them, and it gives me a phone number or a data entry form to schedule it. But no, so they don't take insurance, is how they pull it off. It's strictly cash. And they say, this is it. Yeah. And they're very upfront with it. We don't take insurance, but this is the cost, right? They're trying to change that model. Now, not an option for large health system or even critical access, right? We have to stay within the current model of taking insurance. It's a balance. All right, so here, then here.
Yeah, one thing you mentioned, millions or trillions of pieces of paper and information. One thing that we need to really be doing is disease prediction, and that is starting already by some organizations who have organized it in about 50 DRGs. They can predict certain diseases. So when we talk about customer, that's I think an ultimate. It's not easy to get to, but taking all that data, there are systems right now where you can predict the certain diseases.
Yeah, our large language models and AI is phenomenal at that, right? That's right up their alley to be able to get them there, and we are getting there. We're going to go here, and then we'll come over here if that's all right, just because the mic's over here.
My speech teacher always told me I never needed a mic. But anyway, just experience when you're talking about estimation. There are bolt-on tools that it does take work with the staff to make sure that data's worth a lot of money. But I worked with the hospital system down in Baton Rouge, Louisiana, 6 hospitals. They installed a estimation tool. And after they did a lot of tweaking, probably over a 6-month period of time, their estimations were within 10% variance, and that was it. And their community almost demanded it after that, because when they called, you can put in their primary, secondary, tertiary insurances. It would calculate what overall what the patient owed.
Yeah.
So it was phenomenal. It took a lot of work, but it is, it is doable. But
technology is no longer the bottleneck, right? It used to be we didn't have the tech to accomplish what we needed to. The bottleneck now is time and money. Right? How much time and how much money do I have to devote to this specific issue that I'm tackling?
Yeah, it's all the data. You've got to have people there that are tweaking it all the time. But
yeah.
it can happen, but it is a lot of work.
Absolutely. All right. And then here, right? Okay, apology. Yeah, I'm way over here. Sorry.
So just one follow-up again, kind of what I alluded to earlier. I think dental is a great example, and again, within Washington State, those of us that live here, I forget the exact percentage, but the network, Washington Dental Service, is probably, 80%, maybe 90%, high penetration. And so again, standardization, most dentist office, you do WDS, huge, consistency compared to, again, I'm in a small county, 50, 60,000, yet there's 5 Medicaid plans, there's like 8 or 9 Medicare Advantage options with all different platforms requirements, and so the time and money to implement that, to get to that 80%, it's so fragmented. So that's, that's our challenge. So we're thinking of cutting back and disenrolling payers so we can streamline it.
Absolutely. I was working with a hospital the other day that they actually were able to get all their payer contracts are essentially the same. It's taken them about a decade, but then it meant regardless of the payer, I know that they all have the same discounts and I have my CDM, so it's easy to match, right? But that took a lot of time and effort.
Thank you so much, Eric.
Thank you all.
We